Many of us associate testosterone with sex drive, but low levels can also affect your heart. Here to explain is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine. It's good to see you, Dr. Hansen. Thanks for joining us.
Glad to be here.
So yeah, we do think of testosterone as the sex drive, the
Right.
energy, but how does it affect the heart too?
Yeah, it's so important. The heart has more testosterone receptors than any other tissue in the body. It actually protects the heart from heart attacks, prevents plaque from building up in the arteries, lowers total cholesterol, and it strengthens the muscle. So testosterone is incredibly important, and it's kind of thought of as just for men, just for sex drive or bodybuilding, but women have testosterone too, although 10 times less than a man. They need it for sex drive. So if your sex drive is low, it's not just, oh, I'm getting older, it was going to happen. It really is important because women, 1 out of every 2 women dies of heart disease as well. So it's real important for women and men to get their hormone tested and get up to the right level.
Are there symptoms that we might be really low in testosterone?
Yeah, there's a lot of symptoms. So let's look at some. So obviously the first thing is sex drive. Your sex drive is gone. You know, you're low in testosterone. Persistent fatigue. If you're really fatigued all the time, that could be it. Loss of muscle, increased fat. If you're wondering why at age 50 you start gaining weight all of a sudden, you're losing muscle, which is the furnace of fat burning. Increased heart disease we talked about. Also moodiness, depression. It's a natural antidepressant. You get depressed and you also get anxious. So it really affects mood and energy and the heart and the sex drive. It's really
here's
important.
a patient that came to see you because the symptoms sound like a lot of women.
Typical patient, we'll call her Jan, age 56. She'd been in menopause for about 5 years with hot flashes day and night, which is estrogen deficiency, the vaginal dryness, which can be estrogen and testosterone, low sex drive, which is testosterone, depression, which is caused by low testosterone, anxiety, which is caused by low progesterone. So there's a natural anti-anxiety hormone. Aches and pains is progesterone, and that weight gain in the abdomen. All those are progesterone symptoms. And the last one, memory loss. We just think of that as kind of, okay, age 50, I'm losing my memory, I can't remember anything now, to make lists. That's pregnenolone deficiency. That's a hormone we call the mother hormone from which the body makes progesterone and testosterone. You need that hormone to bathe and nourish the brain. And a deficiency will lead to a lot of those symptoms. So we look at all of those things and test the whole thing. You get it in balance.
And what do you give your patients for this so they can start feeling better? It looks like bioidentical hormones. You test those,
exactly.
Obviously.
These are the ones we want to test to make sure they're all in balance. We give everyone that's deficient, and we try to lower the ones that are too high. So the estradiol is bad. That can cause cancer and heart disease, actually. So we want to increase risk of strokes. Estriol is the good estrogen. That's the one you want to make sure you have enough of. And progesterone, DHEA, and testosterone, those go together. And then the pregnenolone is that mother hormone that bathes and nourishes the brain, protects the memory.
And then obviously, are these kind of her numbers?
So here's this patient, Jan. She came in initially. You can see the initial labs. Her estradiol, way high, 127. She was taking Estrace, which is a drug that's estradiol, and her level was way too high. And she still had hot flashes 2 to 3 times every night and 5 to 6 times in the day. And 3 months later, it was back to, it should say normal there. It was back in the normal range. Estriol was really low. We had to raise that up. Progesterone was low. DHEA, testosterone, you see less than 12. They stopped counting at 12.
Wow.
She was really low. And the pregnenolone, less than 5. It should be 100. So she was really low in all her hormones. So we supplemented estriol first at night, and within 2 weeks, she came back and said, I am feeling wonderful. Wow. I'm sleeping through the night, no more night sweats, but still having some during the day. So we added some testosterone in the morning. So night and morning. Now, 2 weeks later, no more hot flashes, anytime, day or night. Energy's great. Her sex drive is up. She says, I feel like a 16-year-old again.
Wow.
I feel
her husband
years
must
younger.
came in and thanked you.
He was happy.
Now, you have a special offer for folks who are watching who feel like this.
Yeah, go to our website, sign up for our newsletter, and you're automatically registered to win in the drawing a free testosterone test. So you'll find out what your testosterone level is. You need to get them all tested because we got to keep them in balance.
Yes.
That gives your body the ability to bring everything up like a symphony. Everything works together. You'll feel great. You don't have to think it's just an annoyance or just a minor thing. It really relates to heart disease and cancer prevention. So really important women get that feeling great.
Well,
and
people just write it, check it off as part of getting older. It doesn't have to be. Thank you, Dr. Hansen.
Thank you.
So there's a lot of information. So if you would like more on Dr. Hansen, you can go to his website. It's drhansen.com. There's the phone number right there on your screen, the Hansen Clinic of Natural Medicine.